Hi, it's Dr. Matthew Schulman, board certified plastic surgeon, and let's talk about something you may not know exists. Cosmetic belly button surgery. We call it an umbilicoplasty, which is just a fancy name for making your belly button look better. There are a lot of people out there that just don't like the way their belly button looks. Maybe it's just the way you were born. Maybe you were born with an outie that you don't like. Maybe you liked your belly button, but then it changed with pregnancy, or it changed with aging, or changes in your weight. Maybe you had a surgery before, like a tummy tuck or some sort of surgery where they had to go through the belly button, and that caused changes that you don't like about your belly button. So that may be a reason for you to come in and see me so we can look at your belly button and figure out what we need to do. The procedure itself will depend on exactly what your problem is. If you have some extra skin around the top of your belly button that's hanging over, then I can remove that skin and make the belly button look more open and a little happier. A lot of people who have that skin hanging over their belly button will come to me and say that their belly button looks sad and they want it to look more open. So that may be a situation where I remove some of that skin that's around the belly button. If you have an outie, then we can make your outie into an innie. What you have to understand is that if you have an outie, most likely you have something called a hernia, which is a small opening in your belly button and something's poking through. Usually it's a little piece of fat, or sometimes it's a piece of intestine that pokes through and gives you the appearance of an outie belly button. That's one of the reasons why your belly button pops out during pregnancy. A lot of women will say that they had an innie and then they got pregnant and their belly button just popped out. That's because all the pressure from the inside, the pressure of the growing baby, kind of pushes things, and then it makes something poke out through a hernia. If that's the situation, then what I need to do is fix the hernia. So I make a little incision around the belly button. I find that hernia, which is actually just a hole in your abdominal wall, and then I sew that hole shut. That fixes the hernia, and then I can do some special maneuvers to tack the belly button down so I can make that belly button into a cute little innie. If you've had a tummy tuck and you don't like your belly button, then it really depends again on what exactly the problem is. Maybe you have a thick scar that's around your belly button that you don't like, so I would have to remove that scar and try to close it in a way that it looks nicer. Or maybe your belly button after your tummy tuck is too big or too small. These are the common complaints that people have after a tummy tuck. So if you have concerns about your belly button and you didn't realize that something can be done, now you know. We can do cosmetic surgery of the belly button. The interesting thing is, while you probably didn't even know this was an option, this is a procedure that I've been doing for a long time. And in fact, I probably do more cosmetic belly button surgeries in a month than most other plastic surgeons do in their entire career. It's just become one of those things that I've become known for. So I have patients come to me from all over the world for cosmetic belly button surgery. The great thing is that I can oftentimes do this surgery under local anesthesia. So I don't even need to put you to sleep. I just numb up the area, do what I need to do, and because there's no sedation, there's no narcotics, you can just get up, walk out of the office, and go about your normal business almost immediately. So this procedure is more common than you think, and we can do it in a way that it's much easier than you probably think. So if you are unhappy with your belly button, come see me. You know how to contact me. Just use all the available means in the website. Contact me, set up a consultation. I'll take a look and we'll figure out exactly what's wrong with your belly button, what you want it to look like, and we'll talk about the procedure that I need to do to make it look like you want it to.